Before I start the video, I just kind of want to explain what the interview is about. So I had an interview with Dr. Beaber. He's a neurologist, and he posts a lot of videos on social media. And amongst one of those was a video about the yips in sports. More specifically about task-specific dystonia, which is basically a form of the yips, which is what I think I'm dealing with, amongst other things. So yeah, I was very intrigued, and I reached out to Dr. Beaber to set up an interview. So the video you're about to watch is an interview of me and him talking about the yips in sports. That was very, very helpful for me, and hopefully it's also helpful for people that deal with the same things I do. Good afternoon. I'm joined today by Dr. Beaber, who is a neurologist, and we're here today to talk about the yips in sports. If you would first like to introduce yourself for the viewers.
So I'm a clinical neurologist. I see patients full time. I do a little bit of research and teaching, but mostly involved in clinical work. And I see a lot of general neurology like headache, epilepsy, Parkinson's disease. But my primary specialty is immunological diseases of the nervous system, such as multiple sclerosis. But I do see people with dystonia, and I do Botox injections. And we're going to talk a little bit about that today.
Okay, thank you very much. So I will talk a little bit about how I ended up reaching out to Dr. Beaber. So when I started playing darts 4 or 5 years ago, you just start playing, you don't really think about anything. For me, the better I got, the more pressure I got, and I think it came to a point where I started overthinking my throw, my grip. And then about a year and a half ago, I started getting issues with my throw, not really knowing what was going on. I thought it was a grip issue. Fast forward to a year and a half later, I now think that it is task specific dystonia, which you will talk on a little bit more in a bit. Um, what caught my interest is that I saw your video talking about the yips in sports, and it was something that I could relate to in the sense of the cramping and the tightness of the muscles and the tendons. Because when we talk about the yips and darts, it's mostly not being able to release the dart. And so when I first did a video talking about my issues, I had a lot of people reach out and tell me they had similar issues. And then when I saw your video, I thought it was a great idea to reach out and have you elaborate a little bit more, since it was very eye-opening to me.
Well, there are a
So,
lot of, oh, sorry, go ahead.
no, go ahead.
Well, there are a lot of reasons, people may have difficulty in various sports. A lot of these are orthopedic issues outside of my expertise. And when people use the term yips, that's kind of a broad term. Usually people just mean that they have the inability or difficulty in performing a specific task that they used to be able to perform. And I think when most people think of the yips, they think of more of a psychological problem. Like, let's say there's a professional baseball pitcher, and normally they can throw very accurately, but suddenly they're throwing wild pitches, everything's in the dirt, they're walking a lot of batters. And now they're nervous about it. And when they step out onto the mound, they're sweating bullets, their heart rate is 130, and they do fine in practice and can throw accurately, but they just get too nervous during the big game. That is a form of yips, but it's more psychological. It's performance anxiety, essentially. And, certainly there are treatments of that, like seeing a sports psychologist, maybe doing meditation, certain forms of practice. But you were getting at the idea that you had something a little bit different, where you noticed something specific, where you try to initiate the movement, and there's a little muscle tension or pulling that could happen at any time, even if you're not nervous, you're just practicing with the darts. You feel just some kind of subtle abnormal motion of your hand, and that makes it difficult to throw.
Yeah, and that's correct. So, and I also notice it a lot when, for instance, when I pick up a glass of wine with my left, I can do it easily with 2 or 3 fingers. When I do it with my right, my whole hand clinches around the stem of the glass. Same with holding a pen or picking up a small object that I try to turn or twist in my hand. I seem to struggle with that as well. And then also for me, I notice when I'm practicing in the basement, I have it just as bad as when I play on stage. So it's not something that's triggered by pressure and stress, even though it probably doesn't help. It seems to always be the same for me. Um, so yeah, that's what I deal with, and it's something that in darts is not really talked about. And yeah, so I think for me, after trying, I tried all kinds of things. So I tried acupuncture, I tried hypnotherapy, physical therapy. Yeah, pretty much tried it all, and I'm running out of options. So is there any treatments that you would say, if you have anything that I have, that you could do to kind of fix the issues or get things better?
Well, so in general, task-specific dystonia is a type of dystonia. And there are a lot of different forms of dystonia, some of which are actually rare genetic diseases. But dystonia is a little bit more common than people may realize. Like one common example would be writer's cramp. Someone is trying to write and their hand cramps up, and maybe they have to use their other hand to sort of open up the fingers. And if severe, it can actually be very disabling, such that people have bad
Hmm.
handwriting. So many years ago, I had a patient who he was referred for essential tremor, which is actually a generalized condition causing tremor of both hands. But when you talk to him, he said he doesn't have any tremor whatsoever, but specifically when he tries to write, he has a lot of cramping and tremor, and his handwriting was just terrible. But it's with a very, very specific motion. And this is task-specific dystonia, where you're trying to do something very specific and initiates the tremor. Another patient I saw was a harpist. He was not a professional musician, but he was sort of like a high level amateur, played frequently. And he would describe that when he tried to play the harp, his fingers would start moving and curling in, making it difficult to play. And what's interesting is someone with task specific dystonia, we know that it's coming from the brain. Yet, if we do an MRI scan of the brain, it will be completely normal. For example, if you're right-handed, the motor neurons that are controlling your right hand are in the left cerebral hemisphere in the motor strip, and there will be no abnormality whatsoever in that area. Even if the person, let's say, died of a heart attack and we did an autopsy of the brain and dissected that area very carefully, it would look completely normal. However, people have done functional MRI studies, and this is a type of MRI scan where you can see metabolic activity of the cells. And if someone with task-specific dystonia tries to initiate the movement, we'll see an increase in activity beyond what is normal in the motor areas, suggesting that initiating the movement seems to activate more of the motor cortex, suggesting that it's really a wiring problem. Somehow that repeating the task over and over and over again has caused some kind of hyper wiring. So more of the motor cortex and then more of the muscles get activated, causing the cramping and pulling. I just wanted to give a little background, to explain the condition a little bit. So
Right.
go
And
ahead.
sorry, I think so. I had a very complicated throw with a lot of twisting and turning, and I've been doing that same motions for 4 or 5 years, 4 or 5 hours a day. And at the beginning of the issues, I started changing some of that grip and the twisting and the turning of the dart in the hand. So that part that you just mentioned, um, that's what I think caused the issues for me, is that I started trying to change all that, and it's something that I've done the same way for 4 or 5 years, and then now all of a sudden, yeah, my either my brain can't keep up with it, or yeah, so it's like the wiring is broken. That's how it feels to me.
Yeah, and this is more common than people think. Like one very well-known example is golfer's yip, where a golfer is trying to grab the club and then they have tightening of the muscles, and it's just hard to golf like that. The author of the Dilbert comics. If you've ever seen that comic, that cartoon with office characters, very funny. Apparently he was no longer able to create the comics because after years and years of drawing, he developed task-specific dystonia, and it was just hard to control the paintbrush or the pencil, that kind of thing. So it's a little bit more common than people realize.
Mm-hmm.
Now, in terms of the treatments, some of the kind of conservative treatments that people have attempted are trying to do a slightly different motion. So a lot of musicians, if they could play the instrument holding it in a different way, that could potentially alleviate the problem. I know that you were trying to throw darts with the left hand, and it's just very difficult when you're used to gripping the dart in a certain way, you're used to throwing in a certain way, and it's hard to do something differently and still perform well. One thing that I've heard is something called mirror therapy. This is when you perform the action in front of a mirror. And apparently, part of what may be triggering the dystonia is the visuals of it. And so if you look in a mirror, everything is reversed. And that may somehow break the pattern of activating all those, motor neurons. So some people have tried to play an instrument in front of the mirror, and that could help, that kind of thing. Sometimes there could be a stress-induced component of it where people have worse dystonia, even if it is a neurological condition that's triggered by stress somehow. And, one of the things that people have attempted is Botox injections. Botox is botulinum toxin, and it's a poison that weakens muscles. But if injected into specifically the muscles that are tightening it up, it could help with the symptoms. Now, the challenge is, you're a darts player, and presumably you have a lot of tension, like in the thumb muscles, maybe the adductor muscles of the thumb that pulls the thumb in, or the opponent's muscles of the thumb that helps to oppose the thumb. But injecting Botox into that area could cause weakness, which could affect you in a different way, even if it helps with the dystonia.
Mm-hmm. Yeah, and that's one of the things I read online. And as of right now, the last the last option of treatment that I see, that I've tried. But yeah, I read on some studies about it, and that it's, I think, about 70% successful or 60% successful in people where they injected it. Yeah, the only question is, does it create too much weakness for me to really perform? But the other thing that you mentioned as well is, when I did switch back to my right, rather than try to fight it, I try to find a way to work with it. So when I do have that tension and cramping in the thumb, that I develop a throw that I'm still able to hold a dart, even though my hand is doing that. It's quite challenging, but it has improved my game. So hopefully that is something that over time, perhaps I will develop in a new kind of throw for me that I can get comfortable with.
Well, one story I heard was an American baseball pitcher named Daniel Bard, and he was a top pitcher, a star pitcher, but he developed the yips and started having trouble throwing. And I don't know any of the details of his condition. I don't know if he has task-specific dystonia, but apparently he was actually able to change his delivery. And so instead of pitching more overhand, he had more of an underhand delivery. So he's became a submarine pitcher. And he was able to get back to the major leagues and perform well and throw at a high velocity, but he couldn't pitch overhand. He had to completely change his delivery. So it's a very individual thing. Darts is a very unique thing. It's hard to say what's going to work for a specific person.
Right. And would taking a break, for instance, would you forget about having the dystonia, or do you think it's something that you actively have to, a problem you actively have to tackle, rather than try to forget about it and give it time, and hopefully in a year's time it's gone? Or is that not an option?
Well, I don't know the answer to that. I mean, this is definitely the type of thing where practice doesn't make it better necessarily,
Mm-hmm.
because, it's potentially caused by repeating the same motion over and over and over again. And, I haven't really seen in my personal experience, competitive athletes who have tried just not competing in the sport and see if it goes away. I don't have any personal experience with that. I mean,
Right.
have you talked to other darts players and they said they had some relief by taking a break from it?
Yeah, so the feedback has kind of been mixed. So some players, but most of them that I talk to have the problem of not being able to release the dart, where it's more of the anticipation of the dart leaving your hand, so they just simply can't let it go. Um, but yeah, there's been. I feel like everyone has come out of it a different way. For the players that did come out of it, so some of them said I did acupuncture. Some of them said I did hypnotherapy, and I don't know if it's those actual things that they did that helped him, or if it was just over time it disappeared. But yeah, so that's very mixed. Some players said they started throwing with ping pong balls at first in order to get that right. What I do notice, I have a set of wooden darts that are a little bit thicker and bigger, and those I seem to be able to throw easier because they're a little bit more bulky and they're not as fine as a tungsten dart. So it's easier to hold for me. So I think the ping pong balls, and then over time switching the darts, of course, players that started throwing in the dark. Um, yeah, not sure. Those are all different things that I have heard. I personally, I started working with mind lift. So yeah, that was the side of the brain to tackle that. But I've done that for a few months. Do a lot of meditation because I do think with the issues, if it wasn't mental, it will become mental over time. Where if now I've been struggling for a year and a half. So when I step on a stage, obviously it becomes more and more of a challenge, knowing that I might have a hard time performing. So yeah, it's a very I think it's a very difficult subject, and that's why I'm happy that we can at least talk about it. And the fact that we talk about it, there's a lot of people that when they see this video, they might relate to it and they might actually understand. Because I think once you understand the problem, then you can do something about it. And yeah, that took me a long time to even realize that it isn't just me, or that it isn't just because I'm not capable of, that I'm not good at darts anymore, and that there's underlying issues. So that's it's very helpful to have this conversation.
Well, I think it's totally normal that you're going to be stressed out if you're not performing well, regardless of the reason. Even if it was due
Hmm.
to arthritis, it's going to stress you out if you're not performing well. The people I have seen who have had Botox have been relatively happy. Like, for instance, the gentleman who had the writing dystonia, he, had good results. I mean, his handwriting definitely improved. Another common form of dystonia that people get Botox for is torticollis, where the muscles of the neck have increased tone and it can cause the head to pull to one side. It can be painful, and those people tend to be relatively happy with the results. I
Hmm.
have never performed this personally, but one form of dystonia is vocal dystonia, where people can get muscle contractions of the muscles of the larynx, causing a strained speech. And there are some people who know how to perform Botox injections to help with that, and people have gotten good results. So it's not perfect, and it could cause weakness, but that kind of thing can help for some people. There's not a quick cure, but I definitely think there are some people who get improvement.
Okay. And so I have an appointment with a neurologist that I'm looking forward to. Is that something you'd recommend if you have similar issues that I have, that to start with seeking out a neurologist that could potentially help you?
I think so. I mean, I've never treated, a competitive athlete with dystonia personally. There's a movement disorder specialist that I work with, and I asked him, "Have you ever seen a darts player?" And he said no. And I said, "Have you ever seen a, competitive athlete?" And he said no. So this is a rare thing, but
Hmm.
it may be something that's a little bit more common. But if you're not a professional, you probably wouldn't really seek out this treatment. You
Right.
probably wouldn't be willing to take the risk maybe of getting Botox injections. I mean, I think Botox can be a challenge because it's hard to say exactly what muscle is being activated. You have to look very closely at your hand and kind of see where is your thumb going and what muscle is tightening up. And there is a little bit of voodoo to it. There is a little bit of guessing. And sometimes, with Botox, we try maybe a low dose and see what the effect is. And, sometimes we give too much, there's too much weakness, or we inject the wrong muscle. So there's a little experimentation involved in this.
Okay. Yeah. I think I think we covered pretty much everything. Is there anything that you would like to add, or that you think is important to know um, for dart players that might struggle with this?
Well, I think the main thing is, you know, obviously someone could have the yips that is more anxiety related. The kind of key features that would suggest to me that it could be task specific dystonia would be, like you said, you're having problems no matter what, even in practice when you're totally relaxed, and that you notice like a sensation of movement or tremor or pulling of the muscle or tightness of your hand such that it's hard to let go of that dart.
Hmm.
That's kind of would suggest that it may not just be performance anxiety. It might be something completely different. And, this is a weird, rare thing. It's not something that a lot of doctors are going to have experience with. Probably the person most qualified would be a neurologist who's a movement disorder specialist. If I saw a professional darts player who told me they had tightness of the thumb, when trying to throw darts, I would offer Botox injections if it did seem to be task-specific dystonia, and just kind of warn them of the risk of the treatment, that it can cause weakness. And if it does cause side effects like that, they'll likely go away after 3 months because the Botox gets metabolized. And if you need ongoing treatment, typically we would have to do it every 3 months.
Okay, that's good to know. I'd really like to thank you for your time, and we'll make sure that we add your social accounts on the video as well. I think there's some very good videos on there, very very useful. So yeah, thank you very much.
Well, I appreciate talking to you. I think it's awesome that you're trying to overcome this. And whatever treatment you pursue, I wish you very good luck and returning to competitive darts.
Appreciate it. Thank you.